Hey, in this video today I've got Capzasin HP and I'm going to give you my honest physical therapist review of Capsaicin. The active ingredient in this is capsaicin, which is actually something that's found inside of chili peppers. Now the label on this reads that it's appropriate for use with arthritis, simple backaches, sprains, strains, bruises, and cramps. Now before I open it up and put it on, show you how to use it, let me just tell you a little bit about capsaicin. Capsaicin, like I said, comes from chili peppers, and you can see on here the concentration. Let me see if we can zoom in good enough. It's at 0.1%. Now I do have to tell you that that is one of the lowest concentrations of active ingredients I've seen. Typically when you see these pain creams, these topical analgesic, the pain relief creams, they're like at 15%, 10%, give or take a few percentage points. But that's for like camphor and menthol and other active ingredients. But this stuff must be potent if they only want to put 0.1% of capsaicin in here. Now I did a research review for this, and there actually is research supporting capsaicin as a pain relieving product. The one study that I found in particular compared it to NSAIDs, non-steroidal anti-inflammatory drugs, and it was a meta-analysis, so they didn't go head-to-head in the same research study. But what the researchers looked at was studies where people were using NSAIDs like ibuprofen and naproxen, and they compared their improvements to studies where they used capsaicin, like what's in here, and they compared their improvements, and they found the improvements to be close to the same with both products, of course this being capsaicin and not a drug. I put that research study in the link in the description below in case you're one of those nerds and you want to go look it up. You can do that. Hey, there's no shame in being a nerd. You're looking at one right now. Now the only warnings on here, kind of side effects, is it says if you develop redness on your skin that doesn't go away, then you need to stop using this. And if it doesn't go away completely, you need to go see a doctor. Give it a day, maybe 2 days. That stuff needs to go away. The other thing is it says not to put it on your eyes. Don't put it in anywhere that can go inside your body, your mouth, any openings whatsoever. You don't want to put this on. And if you get it on your hands, you need to wash your hands immediately. And the instructions on this are to rub it on 3 to 4 times a day. It doesn't say exactly how much. It just says to put it on until it disappears. And it does say not to use it for people who are 18 years or younger. So you should probably consult your doctor if you're looking at using this with somebody who's 18 years or younger. Now, one more side note about this, it does say not to put a wrap over your body wherever you put this on. So for instance, if you're gonna rub this on your shoulder or your elbow, don't wrap it up. Make sure you're not covering up the area. And I think part of the reason for that is so that you know that it's this causing a problem if there is one and not the wrap. And also so that you can see your skin, because if you have redness developing, you may not feel it necessarily because this is supposed to give you like a sensation on your skin, but if it's covered up by a wrap, you're not gonna see it. So let's open this up. We've got the little foil covering there. Let's peel that off. All right, this foil stuff doesn't come off very easy. I am just gonna poke a hole in it with my scissors. There we go. Made the hole. There's some of the lotion on my scissors. And it doesn't say how much to put on, so I guess you just put on whatever you want. And here's what it looks like coming out of the tube. There you go. And I'm gonna smell it for you. It's kind of odorless. Has like a lotion smell, like an odorless lotion smell. That's kind of an oxymoron, right? No, odorless lotion smell. And I'm gonna have to wash my hands because it's on my fingers here. I'm just gonna rub it in to my arm, just like so. And it says to rub it in until it disappears. Massage it in, it says. Let me massage just a bit. Oh yeah, I haven't massaged this part of my arm in a while. Needed it. And there you go. It's very, very mildly tingling. Super mild. Menthol is much stronger than this. And it doesn't really smell like anything. I'm not gonna rub my eye or my nose with this. It goes on super easy actually, and I like that it's liquid based as well. So there you go, that's how you apply it. You would put it on 3 to 4 times a day to your affected area. It's for arthritis, backaches, sprains, strains, and cramps. Let me give you my honest opinion about this. I personally have not used this on a consistent basis, but many of my patients do, and they like it a lot. I have yet to meet a patient that tells me that they do not get relief from it. Whew. It's just started now to give me like a little burning sensation. Real mild though, it's not bad at all. And so my patients like to use this instead of using pain medications like your Tylenol, aspirin, ibuprofen, naproxen, those kind of lab-made drugs. This, of course, is derived from chili peppers, so it's got a natural root in it. The roots of the active ingredient are natural in that it's capsaicin. And there are studies to show that this could be helpful for you instead of using ibuprofen or naproxen, your NSAIDs, non-steroidal anti-inflammatory drugs. So it's definitely worth a shot. I like it a lot, and it's comparatively, it's not that expensive. And the only risk in using this is if you have some sort of allergy to capsaicin or chili peppers. You wouldn't ever eat this. It's really, I thought it was going to be more burny on my skin, but it's very manageable. It's not bad at all, and I think it's actually just fine. It just feels like a nice warm tingling sensation. It's like a fraction of the intensity of menthol, which is like what you find in BioFreeze and some other products like topical analgesic products, the pain relieving creams. Another point that I like about this is that it's not oil-based, so I'm not really worried about my shirt getting dirty if it gets on there. And it's very moisturizing. It's actually a very good moisturizer. My hands were very dry right before I started this video because I've been washing them all day. And my hand is all of a sudden very soft where I was massaging this into my arm. Well, my arm's pretty soft as well. So overall, I give this my approval. This is a great option to use instead of pain medications. Just understand this is only going to give you temporary relief. The instructions, the label on here does say that you need to stop using this after 7 days if you don't get any sort of improvement, which is a sign that you probably have some deeper problem going on and you need to go find some long-term solution. Here in this channel, we make videos with helpful advice, tips, exercises, and stretches for a variety of conditions. We probably have videos to help you with your specific problem. If it's like knee pain issues, back pain issues, shoulder, hip problems, we have videos to help you out with those specific problems that you don't need to rely on short-term things for, but this is a good alternative just to get you some sleep, to get you through the day. You can learn more about our videos by going down into the description of this video here and find our link to our playlists. If you want to buy Capsaicin, we've also got a link for it to purchase it on Amazon. And if you want to learn about other products like Capzasin HP, there's a playlist there for all our product reviews that we've done so far. Hey, I hope this video was helpful for you. If you have any questions, drop a comment below. We'll get back to it as fast as we can. And give us a thumbs up, give us a like on this video, and share this with somebody that you think might need to see this. Thanks for watching, friends, and I'll catch you in the next video. Bye-bye.